Comparison of bronchitis versus bronchiolitis, organized by headings, with explanations for each point. Number 1. Definition. Bronchitis. Inflammation of the bronchi, the larger airways that carry air to and from the lungs. This inflammation causes swelling, increased mucus production, and narrowing of the airway. Bronchiolitis. Inflammation of the bronchioles, which are the smallest branches of the airways. These narrow airways can become easily blocked, making it harder for infants to breathe. Number 2. Age group affected. Bronchitis. More common in older children, adolescents, and adults. Acute bronchitis can affect anyone, but chronic bronchitis is mostly seen in adults with risk factors like smoking. Bronchiolitis almost exclusively occurs in infants and toddlers under 2 years old, with peak incidence in babies 2 to 6 months old. Number 3. Main causes. Bronchitis, usually caused by viral infections like influenza or rhinovirus, though bacteria can sometimes cause it. Irritants like smoke, dust, and air pollution can also trigger it. Bronchiolitis, primarily viral, most commonly respiratory syncytial virus, RSV. Other viruses include influenza, parainfluenza, adenovirus, and metapneumovirus. Number 4, airway involved. Bronchitis affects the bronchi, which are larger, more rigid airways, so obstruction is usually mild. Bronchiolitis affects bronchioles, which are tiny and more prone to swelling, mucus obstruction, and collapse, leading to significant breathing problems. Number 5, cough type. Bronchitis typically has a productive or wet cough due to excess mucus in the bronchi. The cough may last 1 to 3 weeks. Bronchiolitis. Cough can be dry or slightly wet, but is usually accompanied by wheezing and difficulty breathing, which is the main concern. Number 6, breathing difficulty. Bronchitis, usually mild, may have slight shortness of breath during exertion but rarely life-threatening. Bronchiolitis, often severe in infants. Signs include rapid breathing, nasal flaring, chest retractions, grunting, and cyanosis in extreme cases. Number 7, fever. Bronchitis. Fever is usually low-grade or absent. Bronchiolitis. Fever is more common, especially in the first few days, and can be accompanied by malaise and poor feeding. Number 8, lung sounds. Bronchitis, coarse, raunchy, and wheezing due to mucus in larger airways. Bronchiolitis. Fine crackles, wheezing, and prolonged expiratory sounds due to narrow bronchioles and trapped air. Number 9, severity. Bronchitis, usually mild and self-limiting, resolves within 2 to 3 weeks. Chronic bronchitis may develop in adults with ongoing risk factors. Bronchiolitis can be severe in infants, especially those who are premature or have heart-lung conditions. May require hospitalization for oxygen therapy or fluids. Number 10, risk factors. Bronchitis. Smoking, air pollution, underlying lung disease, asthma, COPD, immunosuppression. Bronchiolitis. Prematurity, low birth weight, congenital heart or lung disease, weakened immune system, exposure to RSV, daycare, siblings. Number 11, treatment. Bronchitis. Mostly supportive, rest fluids, antitussives if necessary. Bronchodilators may be used if wheezing is present. Antibiotics are only needed if bacterial infection is confirmed. Bronchiolitis. Supportive care is mainstay. Hydration, oxygen therapy if low oxygen, nasal suctioning. Medications like bronchodilators, steroids, or antibiotics are usually not helpful. Hospitalization may be needed in severe cases. Number 12, complications. Bronchitis, rare, but can develop into chronic bronchitis in adults, especially smokers. Secondary infections like pneumonia can occur. Bronchiolitis can lead to severe respiratory distress, dehydration, and, rarely, respiratory failure. Infants may have recurrent wheezing or higher risk of asthma later in childhood. Summary. Bronchitis. Large airway, older children, adults, usually mild, wet cough, sometimes bacterial. Bronchiolitis. Small airway, infants, can be severe, wheezing and breathing difficulty, almost always viral. Thank you. Have a wonderful day.